Say I'm in here like this, you have to get him to relax first. So right now I can feel his inferior angle right here. I can get a perch, just kind of moving it around. With him, I'll probably dig under here a little bit to check upward rotation. I can get under his medial border, I just have to move it around a little bit and dig a little. See, now I'm under here, and now I can check, pull it off, right? I can check upward rotation, getting a real grip on it here. I can check downward. I'm kind of using my thumb. That may not be the best for your thumb, so don't do it all the time, but I like to use my thumb because it gives me a little control. Or if you're not wanting to, you can just kind of get in here as much as you can. You can do the protraction, right, pulling away, retraction. Is this painful though?
No.
Elevation. Just, it's not simple in some ways, but in some ways it is simple. You're just moving the scapula. It's just a bone. If you just saw the bone on someone, if this were a skeleton, you just grab it and you move it around. You feel how it moves, and you compare it to the other side. Is there movement problems? Does one side feel stiffer than the other? If it's not stiffer than the other, and they're both, it feels like if it moves around easy, then that's probably not your first go-to treating thing. With him, I'd compare, I'd say, okay, it can upwardly rotate. Let's compare it to the other side. If it feels stiffer than the other side, then I may say, maybe I should treat it and see what happens. So, let me show you something sitting up real quick. This is just a freebie. Sometimes you can even assess here. It may be easier depending, just because the way shoulder blades are sitting, I can try to relax. I can move it around here. I can really get under here, right? Not the most comfortable probably, but bearable, right? Yeah. So if they're really tight, I may have to get into this position, move them around so I can really get under there. I may have to move this around, play with this some. Just, it kind of depends what you're going for. If they're tight enough to get to this point, you may have to, that may be an idea. Well, maybe they're tight, maybe I should treat it. If both sides are tight, then I don't put as much weight in it, because now if both sides are equal, then maybe that's not my go-to. It may be, but you won't know till you really treat and check afterwards. So I want to show you guys some more cool stuff from here. So if you're laying down,